In this video, we're going to do a brief overview of the anatomy and physiology of the renal system. Hey, what's up you guys, and welcome back to my channel. So I know I told you that I was going to go headfirst into this huge respiratory series and start talking about the pathophysiology and respiratory diseases. But, well, I lied to you. But I promise I have a good reason for doing so. So I wanted to start talking about ABGs, but you can't start talking about blood gases until you first cover the kidneys, because the kidneys are involved in the acid-base balance of the body. So this video is just going to be a brief overview of the anatomy and physiology of the renal system, with further videos diving into the kidneys a little deeper. So I think that's enough confessing for now. Grab a drink and something to write on, and let's get started. So the renal system has 6 main functions. It regulates fluid volume and blood pressure. It regulates osmolarity, maintains ion balance, regulates pH, excretes waste, of course, in the form of urine, and produces hormones. Now let's start with the anatomy of the renal system. So the urinary system is composed of the kidneys, the ureters, the bladder, and the urethra. Each person has 2 kidneys, and these kidneys are positioned at the level of the last thoracic and the first few lumbar vertebrae on both the left and the right side of the body. The kidneys are behind the peritoneal cavity, and so we call them retroperitoneal, retro meaning behind. Fluid will pass from the plasma and into the kidneys to be filtered. Some of this fluid will be excreted. The fluid that is excreted leaves the kidneys and goes into the long tubes called the ureters. Now there is a ureter on each side of the body attached to a kidney. Filtered fluid passes from the ureters and into the urinary bladder. The bladder holds the urine until a point where it contracts and expels this urine from the body through one tube called the urethra. The process of expelling urine is called urination or micturition. Now there are anatomical differences between the male and female urethra. Males have a longer urethra than females do. And females' urethral opening is much closer to the anus. And this is one reason why women are more at risk for urinary tract infections than men are. Now, renal arteries branch off the abdominal aorta and bring oxygenated blood to the kidneys. And renal veins bring deoxygenated blood from the kidneys and dump it into the inferior vena cava. Now, each kidney actually has a good amount of fat and connective tissue that support it. And each kidney is surrounded by a membrane called a capsule, which helps absorb shock and protect the kidney from sudden force. The kidney tissue itself is divided into 2 layers. The outer layer is called the cortex, and the inner layer is called the medulla. Urine will pass from the medulla into a calyx. From calyces, urine will pass into the renal pelvis and then into the ureter. Now, the nephron is the functional unit of the kidney, and each kidney has about 1 million nephrons. Now bear with me, because this next drawing is going to have plenty of aesthetic flaws. So blood will enter the kidney through the renal artery. The renal artery branches into smaller arteries and then into arterioles. Blood flows from an arteriole known as the afferent arteriole into a network of capillaries that is called the glomerulus. And the glomerulus is just basically this big ball-shaped mass of capillaries. Blood then leaves the glomerulus via the efferent arteriole and flows into the peritubular capillaries. Now, if we break down this word peritubular, peri means around, and the tubule is one of the structures of the nephron. So peritubular capillaries surround the tubules of the nephron. The peritubular capillaries will eventually join up to form veins that take blood away from the renal system. So that was the blood flow of the kidney. Now let's take a closer look at the nephron. So the Bowman's capsule is a hollow structure that surrounds the glomerulus. The glomerulus and the Bowman's capsule are fused together, so the fluid leaving the glomerulus goes directly into the nephron. And the glomerulus and the Bowman's capsule together we term the renal corpuscle. From the Bowman's capsule, filtered fluid passes into the proximal tubule. Now proximal comes from the Latin word proximus, meaning nearest or next. And so proximal means something that is close or near to something else. So the proximal tubule is the tubule that is nearest to the Bowman's capsule. Fluid then goes into a hairpin shaped area called the loop of Henle. And the loop of Henle is divided into a descending segment and an ascending segment. Now the ascending segment will actually pass back through the afferent arteriole and efferent arteriole. At that point, the ascending limb of the loop of Henle turns into the distal convoluted tubule. In this region, we term the juxtaglomerular apparatus, and it consists of the distal tubule in close proximity to the afferent and efferent arterioles. The whole nephron actually twists and folds back on itself, but I have stretched it out here to show the parts more clearly. And also, because if I drew it all clumped together, it would just look like a big mess. And it already looks like a mess, but it would look even worse. After the loop of Henle, we have the distal tubule. And when you think distal, think distant or further away. So the distal tubule is further away from the Bowman's capsule than the proximal tubule is. And after the distal tubule, we have the collecting duct. And actually, about 8 nephrons drain into one collecting duct. And the distal tubule and the collecting duct together are termed the distal nephron. Now the collecting duct passes through the medulla, into the calyx, and then empties into the renal pelvis. And once the fluid is out of the medulla, we can call it urine. So the kidneys filter, reabsorb, and secrete. So filtration is the movement of fluid from the bloodstream and into the nephron. And filtration can only occur at the renal corpuscle, which is again the glomerulus and the Bowman's capsule. So once fluid gets from the bloodstream and into the nephron, we call it filtrate, and it is destined for excretion from the body as urine unless it is reabsorbed. So reabsorption is the movement of substances from the filtrate back into the capillaries, but secretion is the movement of substances from the capillaries into the nephron. So the kidneys filter about 180 liters of fluid each day. But the kidneys don't excrete 180 liters of fluid each day, or we would literally have nothing left in our bloodstream. So almost all of that fluid then has to get reabsorbed back into the bloodstream. Now let's take a closer look at each of the parts of the nephron and what they reabsorb. So the proximal tubule is the site where the majority of water and salt reabsorption occurs. However, the filtrate that leaves the proximal tubule has the same osmolarity as the fluid that entered the proximal tubule. In the proximal tubule, about 80% of electrolytes are reabsorbed, and all glucose, amino acids, and small proteins are absorbed here. The loop of Henle is the place where filtrate is concentrated. In the descending loop, the majority of water reabsorption occurs. In the ascending loop, we reabsorb sodium and chloride. By the time we leave the loop of Henle, the filtrate is way more concentrated than it was when it entered, and most of the filtered fluid has now been reabsorbed. The distal tubule and collecting duct are the places where the fine-tuning of salt and water balance occurs. If water is going to be reabsorbed here, it will occur with a hormone known as ADH, or antidiuretic hormone. And what happens is that antidiuretic hormone puts proteins called aquaporins in the membrane of the distal tubule and collecting duct. These aquaporins allow water to be reabsorbed into the bloodstream from the filtrate. And anything that is left after this final reabsorption and secretion goes into the renal pelvis to be excreted as urine. Now, one last note before we close here. What is excreted in our urine tells us how that substance was handled by the kidneys. And because this is physiology, we have a formula for this. The amount of a solute that is excreted is equal to the amount of solute that was filtered minus the amount of solute that we reabsorbed plus the amount of solute that we secreted. And I hope that this makes sense, because remember, we filter 180 liters of fluid each day. So what we filter is our biggest number, but then we have to subtract what we reabsorb from the filtrate into our bloodstream, because now those substances are no longer in the filtrate, so they're no longer bound for excretion as urine. But wait, there's more. We have to add back in those substances that we secrete from our bloodstream into the filtrate, because what we ultimately have in our filtrate at the end of the distal nephron is what is going to be excreted as urine. Hey guys, welcome back. So I hope that information made sense to you. The kidneys are a really intricate topic, and it took me a long time to understand them completely. So don't feel bad if you need to rewatch this video or look at pictures in your textbook. Share this video with a friend if you found it helpful, and give it a big thumbs up. Subscribe for new videos every week, and stay safe and keep learning. Bye for now.